you?
I'm good. Hi, Dr. Atkins.
Hi. Tell me about your concerns and why you wanted to meet today.
Well, I want to address my son Jack's mode of communication today. He's 3 years old and he has Goldenhar Syndrome, which is a congenital disorder. And he was born without a bilateral auditory nerve and without eyelids, and he's undergone surgery to reconstruct those. And about a year ago, he had a cornea transplant.
Okay. Tell me a little bit how those surgeries worked out in his vision now. I'm asking because vision cues are very important parts of oral rehabilitation, but in your son's case, oral habilitation.
Okay. Well, both of his eyelids are fully recovered now, and then his transplant went really well, and his vision is a lot better than it used to be.
Okay, that's good to hear. Tell me about Jack's communication right now. Is he communicating, and is it effective?
Well, my husband and I have been signing to him since he was a baby, but we're both hearing, so we have a really limited ASL vocabulary. And because he spent so much time in and out of surgery on his eyes, he has a hard time seeing the signs and really knowing them. So I guess his communication right now is really poor, and he communicates a lot through gestures and crying and that kind of thing.
Okay. Does he have any siblings? Does he communicate with them at all? If so?
No, he doesn't have any siblings. His most frequent communication partners are his father and I guess we've been around him so long that we can read him better than other people, and we can read his gestures and stuff like that, but it's still really difficult sometimes, and I just really want him to be able to hear other people and know what's going on around him.
All right, I understand. And do you have any idea of what your options are?
Sort of. I know that obviously hearing aids are ruled out because he doesn't have an auditory nerve, and I don't think a cochlear implant would work, to my understanding. I could be wrong. And my husband and I have been looking at auditory brainstem implants right now.
I see. Yes, you are correct that the cochlear implants would not benefit Jack, as he has no auditory nerve to stimulate the cochlear implant, or the electrode array, for that matter. ABIs are different in that they bypass the damaged auditory nerve or absent nerve and directly stimulate the brainstem.
Okay.
This does not mean that this surgical procedure is more invasive than a cochlear implantation.
Okay. I thought it was more invasive.
It is.
Okay. Okay. Well, that sounds a little scary, but the external part is similar to a cochlear implant, right?
That's right.
Okay.
It is similar because it has an external processor that is worn on the ear and an internal receiver that lies right under the skin, but the electrode array lies within the brainstem.
Okay. So do you think that, based on his condition, that he would be a good candidate for the surgery?
Well, based on his medical history and the fact that he does not have an auditory nerve, I think he would be a probable candidate for the surgery. It's important to know that, like I said before, this is a very complex neurosurgery that has an extensive recovery period. ABI implantation is usually seen in cases of people who have type 2 neurofibromatosis. That means that individuals have abnormally or non-functioning auditory nerves because they have surgery to remove tumors on their auditory nerves. However, this procedure can also be done on people like Jack, who have other etiologies.
Okay. Well, that's really interesting. Do you think, I really want to be able to communicate with him orally and for him to hear me and his family. Do you think that this procedure would allow him to learn how to speak?
Well, that depends. We will need to set up an appointment with the neurosurgeon to see if Jack does qualify and would benefit from this procedure. But let me give you some information on some past results that have come across. Patients with type 2 neurofibromatosis typically see small improvements in hearing abilities, but patients with other etiologies, like your son Jack, have shown results comparable to the best performing cochlear implant users. The key component is timing, and with ABI recipients, it is best if implanted very soon.
Okay, so you think that if we talk about this and we decide that this is the right route, then we need to do it really, really soon?
Yes, that is correct.
Okay.
And since you have seen improvement on Jack's vision, that will be helpful in speech reading training and oral rehabilitation program if you decide to go with the ABI.
Mm-hmm.
It is important to know that this will not fix Jack's hearing loss, and it may never work at all. But I do think any hearing he gains will be an improvement for him since he has been deaf since birth.
Okay, so do you think that if he does gain hearing from this, do you think he'll always be really developmentally delayed compared to other peers his age and stuff?
We don't know yet. He may always be developmentally delayed and may never have perfect speech, but with oral rehabilitation and family support, you may very well be able to communicate better with him.
Okay. Well, this is overwhelming, but I feel better knowing our options. And I understand that Jack may see great results, and he could hear us and communicate better, or he may never hear, but I know that we'll be behind him and support him. And then eventually things like an IEP will have to happen with the school stuff. Okay. But I do feel better after talking to you about all this. So
it's very good to hear. There are some more handouts and resources that I can give you to take home to read with your husband. And if you have any additional questions or concerns, I'd be happy to answer them for you.
Okay, thank you.
Thank you.
Thank you, doctor.
Okay.